Peter Wrobleski. It's July 30th. It's 12 noon, and I'm here because of a required IME exam here at this door. As you can see behind me, Sturkey Chiropractic Center. I'm supposed to have an IME with Dr. Bradley Wiener, and I have the right to videotape the exam, so I am videotaping the exam. Let's go inside.
All right, are you ready with that, sir?
Yes.
So you were injured on May 9th of 2011?
Yes, on May 9th,
And this was,
2011, I was injured.
Okay.
That's correct.
so you were participating in was it a self-defense class and got struck on the left side of your neck?
It was mandatory pepper spray self-defense training class in Curtin Auditorium.
Where it happened, that's irrelevant for me. Just, you got struck on the left side of your neck? That was the injury?
Yes. Glenn Stone karate chopped me on the left side of my neck extremely hard, and I've been in extreme pain ever since.
So you've had a bunch of treatment, including surgery on your neck for the scalene muscle?
Yes, I had
on both
surgery.
sides?
No, just the left side.
Okay. And that was when?
That was in 2014.
Okay. Did that help at all?
No,
Okay.
didn't change anything.
Okay. And what kind of treatment, if any, are you doing now?
I'm taking medication to help with the pain.
What medicine do you take?
I take Oxycontin and oxycodone to help with the pain.
Okay. Did you take those today?
Yes, earlier.
Okay.
And muscle relaxers because
Do you take those earlier?
yes, my muscles are
Okay.
very, very tight, and I get numbness and tingling in my hands, and they start to shake.
Okay. And you've had nerve testing, though, May 11th of this year that was negative, correct?
I've had lots of EMGs.
Right, but the EMG that was done May 11th of this year specifically showed no evidence of cervical radiculopathy.
I don't recall every test.
Okay.
I mean, I know I've had tests that say there's abnormalities with the nerves.
Okay. Other than the OxyContin, oxycodone, the muscle relaxants, are there other medicines that you take?
Yes, anti-inflammatory.
Okay.
Lyrica.
Do you have a list?
Amitiza. I don't have a list with me, but I'm sure Pomco has the whole list.
Okay. Amitiza. What else?
Senecot S. I take that's Lunesta.
Mm-hmm.
I put a heating.
I'm just interested in medications.
Okay. I'm probably missing a few, but those.
Okay, I'll just put down maybe others. Okay.
Yeah, there may be some others that they put in there to try and help.
Okay, so other than the medications that you take, are you doing any physical therapy?
I tried physical therapy several times, and every time I tried it, it just made it worse.
Okay, so you're not doing any now?
Nah.
Okay. Any type of, injections, trigger point injections or epidural injections?
I had, they do Botox, I think, or myoblock injections. Also, I've had epidurals, I think, those
But how about now? I'm asking about now, in the last 6 months.
The last 6 months I've had an epidural. And the last time I had, in the last 6 months, I did have injections into the muscles for Botox.
Okay. Did any of those help you?
It helped a little bit, yes.
Okay, so short-term relief?
Yeah. Any relief, I'll take it. But yeah, the Botox was the most helpful. It helped, but it wears off quickly, unfortunately. When I say quickly,
When was the last Botox injection that you had?
within the last 6 months. I can't remember the exact date, but again, I'm sure
Okay.
Pompco knows because they approved it.
Do you
So,
drive?
the last time I drove a car was in 2012, so no.
Do you need help bathing or getting dressed?
Yes.
Do you have an aide?
No.
Do you use any sort of a cane or device to help you walk?
I just try not to fall down. And I just live with my parents.
You've been out of work since the injury?
Correct.
Any prior injuries to your neck before this?
No.
Okay, so just so that I'm clear, at this point, you're basically treating with medication, you receive some injections, or what we'd call palliative care from, is that New York Spine and Wellness?
Yes. Doctor. What's his name?
There's several doctors there.
Catania.
Okay.
He's my doctor.
And you saw Dr. Eng, a spine surgeon, back in June,
I just saw him. He was the last doctor I saw.
and he did not recommend surgery.
He just looked at the MRI. He didn't touch me, but he just said, in his opinion, he can't help me.
Okay.
And he recommended I go to Louisiana for treatment. Or New Orleans. It's in his report. I think he said New Orleans, and he said you need a specialist. And you won't find that kind of care here in Syracuse. But at the same time, I don't know what I'm supposed to do. Just fly to New Orleans and say, help me?
Alright, so
Yeah.
basically at this point, people are trying to make you feel better, but no one's saying that there's a cure.
Cure, I would rather just just be able to reduce the pain.
Okay, but that's what people are trying to direct their treatment at, trying to make you feel better. As best they can.
They're trying to give, I guess, comfort care.
Okay.
They just, so far no one up here can help me. They keep redirecting me to specialists in, different states or outside the area.
Okay. Alright, so let's have you come stand up for me. Over here. You can face the camera. Alright, nice and easy. Let me know if it's sore at all where I touch.
No. Not down there, no.
Okay.
Yes. 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 Yes.
Just with your head, how much can you look down towards the ground? Okay, how about looking up towards the ceiling?
That hurts.
Okay, I'm aware that you're having pain.
Oh, that's where it hurts.
Okay, don't force yourself. I'm not looking for you to hurt yourself. Alright, take a moment.
I took my muscle relaxers this morning so it helps, but the muscles, right here, whenever somebody pushes in, they say that's abnormal. And I had a neurography exam that showed several abnormalities. Yet, no one here can help me. They keep referring me to other people, like New Orleans.
What type of treatment are they suggesting that you need in New Orleans?
They just say you need a neurosurgeon / plastic surgeon that deals in nerve.
Can you turn to look all the way to the right?
It hurts.
How about to the left? Okay. Are you able to tilt your right ear to your right shoulder at all?
Oh God, no.
Okay.
Not really, no.
Okay. How about for the left side?
That's it.
Okay, relax.
It's like a rubber band just pulling me back.
Can I rest my hand on your head?
Sure.
Does that hurt?
No.
If I press down, does that hurt?
No.
Okay. With your right arm, can you bring that all the way straight up to the ceiling? Not out to the side, come on down. Straight up in front of you. Lifting it straight up.
Oh. Oh.
Okay, relax. How about the left side?
Oh. Oh. Oh.
Can't lift your left arm at all?
If I bend it, I can't straighten it out.
Okay, can you bring your arm out away from your body?
Hurts.
Okay, how about the right side? Okay, relax. Are you able to take your right arm to reach behind you as if you're scratching up on your back?
No.
How about the left side?
If I sit down,
I'm sorry?
when I'm in the shower, I sit down on a seat
Okay.
and I have a stick, and that's how I wash my back.
Okay.
And if I can't, usually my father comes in and helps me.
Do you require assistance when you go to the bathroom?
Having a extreme difficulty with bowel movements.
Because of constipation? From the medication?
I think probably most of it's due to the medication,
Okay.
but without the medication,
Can you bend your elbow up? Okay. Holding your arm here, can you turn your arm out to the side?
Jesus.
Okay, relax. How about this side? Can you bend your elbow up? And turn your arm out. Okay, so you can't keep your arm bent?
It's straining.
Okay, don't do that. Don't want you to hurt yourself.
If I take more medication,
Let's have you turn.
I get more movement, but
Okay, turn towards me. Let me have your hands. If I touch on both sides, does that feel about the same?
the left thumb is a little numb.
I'm not touching your thumb.
That's where it feels like it.
Where I'm touching you now, you feel less on the left?
Yes, the left thumb.
How about here?
That's numb.
Which side?
Left.
How about here?
A little bit.
A little bit on,
The right side.
so the right side here is less, and
Yes.
the rest of the hand was on the left side. How about here?
That feels the same.
Okay. Here?
That feels the same.
Here?
That feels the same.
Okay.
Can I sit down?
Sure.
Thank you.
I have this hand, and have it just rested on mine. Alright, so what I'll do is I'll take care of going through all the records that they sent over. I'll write everything up, I'll send it into workers' comp, and they'll take it from there.
The exam that shows nerve damage is called MR neurography.
Okay, I'm not familiar with that test, so I can't
Well,
write on that, but
if-
that's fine. I understand
If
that.
you don't receive that exam,
Mhm.
then POMP goes withholding it Just
wouldn't-
just letting you know that if you say where's the neurography scan.
Okay, that sounds, again, I'm an orthopedic doctor, so if there's a neurologic test that they're doing to assess for that,
So you don't care. Okay.
well, looks for the records if they sent it over, but that's not a test that I routinely would order myself. That would be something perhaps that, again, a neurologist or a
So the
neurosurgeon.
neurosurgeon that examined me roughly 2 weeks ago that said you need to go to New Orleans and see a specialist. You don't get a copy of that exam.
The one from June 22nd of 2015?
Dr. Ang.
Right, I believe I have that report.
All right. Well, do you know who he's? I mean, he didn't give me an.
I don't have that report in front of me to know exactly what he's referring to there.
Do you agree with that report?
I haven't looked at the report enough to go through that, but I'll take care of writing everything up and I'll send that in to Com. All right?
Okay. Is this exam over?
It is. Come on up with me.